Chapter 36. Liver, Gallbladder, and Pancreas. The liver is the largest single glandular structure in the body. It is located high up on the right side of the abdomen under the lower ribs and just under the diaphragm which divides the chest from the abdomen. Your liver has many important functions to perform, for it is the great chemical laboratory of your body. When one is healthy, the liver works so smoothly that you never give it a second thought. But the liver can be affected by a number of serious disorders, such as virus infections, parasites, disturbances of the circulation, stone formation in the bile ducts, injuries due to poisonous substances, and various kinds of tumors. The liver is rather simple in appearance, but it has many important functions to perform. Most of the foods we eat are stored in the liver, after having been digested and absorbed from the gastrointestinal tract. A vast network of tiny blood vessels arise from all parts of the stomach, small bowel, and spleen. These numerous tributaries unite and become the portal vein, which in turn flows into the liver. This large vein breaks up into numerous channels that pass between all the actively functioning cells of the liver. By this means food materials from the digestive tract are able to reach the liver cells where they are chemically changed and stored. These energy foods are stockpiled until needed by muscles, bones, nerves, and other tissues. Certain vitamins are also stored in the liver cells, particularly those that have to do with production of red blood cells in the bone marrow. Here also protein materials from the digestive tract are recombined into the forms needed within the body. Thus the bloodstream brings what we might call the raw materials from the gastrointestinal tract and leaves them with the liver cells. It then takes finished products from the liver and transports them to the heart to be carried to each organ and tissue. 324 Liver, gallbladder, and pancreas. Neutralizing poisons. The liver has another very important function, that of detoxifying or destroying many harmful poisons and even certain medicines that are taken into the body for other purposes. When the liver is sick, these numerous activities are impaired, and soon the whole body suffers. All this endless activity means that the liver cells eventually become worn out and must be replaced. In most people, the breaking down and building up process continues without any apparent difficulty. In fact, radioactive studies have demonstrated that all the protein in the liver is changed every few weeks. Not only does the liver store food materials, it also produces bile, a golden yellowish liquid that is needed for the absorption of fat from the intestine. Bile is a natural laxative. It actually prevents us from being poisoned by absorbing the byproducts of our own digestion. Should the bile channels become blocked, a serious condition known as jaundice will develop. Later we will speak of this more fully. Another important substance produced in the liver is cholesterol, part of which passes into the bile. It may even form stones in the bile ducts and gallbladder under certain conditions. Another substance is prothrombin, essential for the dotting of blood. Urea, an important component of urine, is also produced within the liver. The production of all these substances may be changed under certain disease conditions. If vitamin K is not present, or is interfered with through the action of certain anticoagulant medicines, such as bicameral, the level of prothrombin in the blood will fall. Under certain conditions, vitamin K may not be absorbed too well from the intestine, so that there are insufficient quantities to meet the needs of the body. In such a case, frank bleeding may occur in various parts of the body. Bile salts must also be present in the intestines to allow vitamin K to be absorbed. Hence, anything that hinder the normal flow of bile into the intestine will greatly affect the functions of the liver. Liver tests. A number of different types of liver function tests are available to help doctors trace the causes of liver trouble. Each test has a diff. Jaundice 325. Ferrant meaning and must be carefully interpreted. Some tests measure the level within the bloodstream of certain substances. The amount of change in the test related to liver function roughly approximates the amount of illness or injury. Thus an injured liver will give an abnormal reading and help to guide in the treatment required. These tests are also valuable in gauging the effect of treatment. For instance, the transaminase test measures the level of a certain enzyme which has been liberated from injured cells. This becomes a fairly reliable index as to the severity of an injury and can be used after heart attacks, as well as obstructive jaundice and acute hepatitis. Jaundice. Jaundice is a disease marked by a yellow discoloration in the skin or in the whites of the eyes. This is due to excessive amounts of bile in the bloodstream. Jaundice may arise from a number of different causes. Some types of jaundice arise from conditions outside the 326 liver, gallbladder, and pancreas. Liver. Also, in some cases the patient may have jaundice in a subclinical form. That is, the bile pigment may be elevated but not sufficiently to actually discolor the skin. Normally there is a certain rate at which the red blood cells are broken down and destroyed in the body. The average life of a red cell is about 4 months, but certain disease conditions may cause an excessive breakdown of red cells, and this increases the bile pigment in the blood. Such a rapid breakdown of cells may be seen in hemolytic anemia, sickle cell anemia, pernicious anemia, and jaundice of the newborn, as well as in malaria, pneumonia, yellow fever, and certain bacterial infections of the blood. Obstructive jaundice means that the bile is backing up into the bloodstream because of some obstruction involving the larger bile ducts. The normal liver produces about 1 pint of bile every 24 hours. This is transported to the gallbladder where it is concentrated and becomes green, or else passes directly to the small intestine where it acts as a lubricant. Bile is also necessary for the absorption of fats and for its laxative effect in the large intestine. Bile gives color to the feces. When it is absent, the stools become very light, almost white in color. Anything that obstructs the flow of bile to the intestine will not only produce light-colored stools but may also result in jaundice. The obstruction may be due to a stone or stricture in the bile ducts, or perhaps to hepatitis or cirrhosis of the liver, or even cancer in the head of the pancreas. Stones in the common duct are a frequent cause of jaundice. The patient notes a sharp, sudden pain in the upper part of the abdomen near the midline. Fever soon develops, and after a few hours or days jaundice will usually appear. It is first seen in the whites of the eyes, later spreading to all the skin and mucous membranes of the body. Jaundice is particularly common in middle-aged ladies who have had several children. Jaundice due to cancer comes on more slowly, and there is little or no pain at the beginning. In either case, the jaundice will continue until the obstruction is removed, and may last for weeks or months, depending on the patient's general condition. In acute hepatitis, on the other hand, jaundice may appear quickly but usually subsides within a week or 10 days. Treatment: one must first find the cause of the jaundice. If the trouble is due to some parasite, such as the malaria parasite, suitable. Hepatitis 327. Medications may soon bring the condition under control. If the jaundice is due to the presence of a stone or other obstruction, surgery will be needed for relief and cure. The sooner the obstruction is relieved, the less her damage. The patient should be kept on a low-fat diet, as outlined in the appendix. Seriously ill patients should always be treated in hospital where they can be fed intravenously if necessary. In cases of serious bleeding, vitamin K should be administered, preferably in injections during the acute phase of the disease, and later in tablet form. Hepatitis. Hepatitis is an acute inflammation of the liver caused by some infectious or toxic agent. The skin may be discolored and the whites of the eyes turn yellow. Usually there is some tenderness over the liver in the upper part of the abdomen. Most of these patients have fever, and many of them are very ill during the acute stages of the disease. Various substances and organisms may be responsible for hepatitis, including genus, viruses, toxic agents, such as carbon tetrachloride, chlorpromazine, and many other substances used either as medicines or in modern industry. In rapidly fatal cases, a very serious condition known as acute yellow atrophy may occur. This is quite rare, but must be borne in mind as a possibility. Pointing up the seriousness of jaundice whatever its cause. Infectious hepatitis often occurs in epidemics, due to certain viruses spread mainly by contaminated food or water. Young people are most frequently affected. Epidemics of infectious hepatitis are more common in wartime. Crowding, poor sanitation, and malnutrition all play their part in this disease. In many cases it seems to take from 2 to 6 weeks for the disease to develop. This more common type of jaundice usually begins abruptly with nausea, vomiting, fever, general weakness and loss of appetite. The liver is tender to the touch. In the more severe cases jaundice may be quite noticeable, but in milder cases there may be few if any manifestations of jaundice. This disease continues for 10 clays to 2 weeks and then tends to disappear in some eases. The spleen is enlarged and there is often considerable itching of the skin, as well as intermittent diarrhea. F22. 328 Liver, gallbladder, and pancreas. Bile may also be seen in the urine, particularly during the early phases of the disease. Most cases recover after 6 to 8 weeks, but relapses are fairly common in people who go back to work too soon. Those who have to subsist on a poor diet, or who use alcohol, are likely to have a longer period of illness. The patient should be under medical observation for several months even after he feels he has recovered. Hepatitis as a highly infectious disease. The patient should be strictly isolated during the active phase. Gamma globulin may be given to those exposed to hepatitis in the hope of preventing the disease, especially if they are already ill from other causes. Treatment: keep the patient in bed as long as there is any sign of jaundice, abdominal pain, or tenderness over the liver. At least 3 weeks in bed is advisable. The patient may get up to go to the bathroom, but otherwise should remain in bed. His diet should be rich in protein and carbohydrates as suggested in the appendix, but low in fats. He should also be given vitamin B complex to help restore his lost appetite and to help heal the liver. He should be careful not to overexert himself. Tendency to fever may indicate a relapse. The patient should then remain in bed several more weeks, until he has made a complete recovery. Steroids, such as prednisolone, may be used for very severe cases but only on the advice of the family physician. Serum hepatitis is also due to a virus, but is a different disease from the infectious hepatitis described above. The particular virus causing serum hepatitis seems to be transmitted either by blood transfusion or through the use of unsterile instruments in a medical laboratory, or perhaps from contaminated dental drills. This condition takes from 2 to 5 months to develop, so that the true cause is often hard to trace. The onset is more gradual than in the case of infectious hepatitis. Infectious hepatitis occurs more commonly in children and young adults, while serum hepatitis more frequently occurs in people who are over 30 years of age. The treatment is similar to that just described for infectious hepatitis. Toxic hepatitis is caused by a wide variety of chemicals, either swallowed, minded, absorbed through the skin, or perhaps taken by injection. It is the liver's function to detoxify or destroy any poison circulating in the bloodstream. If large amounts of a certain chemical are taken into the system, the liver itself may be injured so that it. Hepatitis treatment 329 can no longer destroy toxins or poisons. Common substances causing liver damage include carbon tetrachloride, chloroform, arsenic, phosphorus, sulfa drugs, chlorpromazine, and drugs used for treating such ailments as tuberculosis and thyroid conditions. If the liver has already been damaged because of malnutrition or alcoholism, toxic hepatitis is much more likely to occur. Toxic hepatitis is similar to the others just discussed, except that there may be less fever. Patients suffering from this disease complain most of itching and jaundice. Treatment: find the toxic agent and remove it, if at all possible. Patients with toxic hepatitis should not drink alcohol under any circumstances. They should be given a diet rich in protein and carbohydrates, but low in fats. Most will recover if given the right treatment. One grave complication is acute yellow atrophy of the liver, which may develop in heavy drinkers or those suffering from malnutrition. As the jaundice deepens in color, severe vomiting, as well as pain around the liver, may be noted. This is followed by headache, mental dullness, and tremors or twitching and even convulsions, delirium, or stupor. These patients are very ill and should be treated in hospital where tube feeding and intravenous fluids can be administered. ACTH and cortisone are of value in those who are seriously ill with acute yellow atrophy. Amoebic hepatitis, this disease is more prevalent in the tropics but is also found in temperate areas. Amoebic parasites find their way into the body through contaminated food and water. Within the digestive system they multiply rapidly. Some of them are then transported through the bloodstream to the liver, where they lodge in the capillaries and invade the near-by tissues, producing a typical picture of hepatitis similar to those described above. See page 375 for further information concerning amoebic infections of the intestines. Fatty liver is due to excessive amounts of fat being deposited in the liver cells. This occurs most frequently in overweight persons and is usually due to excessive intake of food, particularly fats. Certain intoxicants, such as alcohol, carbon tetrachloride, and chloroform, may also produce a fatty liver. It may occur in certain cases of tuberculosis, diabetes, anemia, iodine deficiency conditions, such as pellagra. In this disease the liver is enlarged and tender, and there may be jaundice, fluid in the abdomen, excessive bleeding, and other. 330 Liver, gallbladder, and pancreas. Evidences of liver failure. The patient should be given a high-protein, low-fat diet, add 2 or 3 teaspoons of dried yeast powder in milk twice daily between meals, or 2 yeast tablets 2 or 3 times a day as needed. He should go on a reducing diet and avoid the use of alcohol in any form permanently. Cirrhosis of the liver. The most common of several forms of cirrhosis is portal cirrhosis, also known as Laennec's cirrhosis. Often it is associated with alcoholism, usually in older men. Poor nutrition seems to be partly responsible and may account for its prevalence among alcoholics. In some cases chronic poisoning with industrial fluids, such as carbon tetrachloride, may also play a part. In the early stages of the disease there may be nothing more than frequent attacks of gas and indigestion, with occasional nausea and vomiting, and perhaps some abdominal pain and weight loss. As the condition advances, the patient begins to run a low-grade fever. He has foul breath, jaundiced skin, and distended veins on the abdomen. So-called spiders are seen on the face, neck, arms, and trunk. These are hair-like, reddish markings in the skin somewhat resembling small spiders. As the disease continues, the abdomen becomes bloated and swollen, the mind is clouded, and there may be considerable bleeding from the stomach. Treatment: during the severe stage keep the patient in bed. He must avoid the use of alcohol in any form. His diet should be rich in proteins and moderately low in carbohydrates and fat. If possible, he should have at least a quart of milk a day, as well as extra vitamins in the form of brewer's yeast and B12 injections weekly. Salt should be restricted, particularly if there is swelling in the legs or abdomen. If massive bleeding occurs, the patient should be rushed to hospital and remain there until the hemorrhage is under control. Biliary cirrhosis is a rather rare condition caused by some obstruction, such as a stone in the common duct or some narrowing of the bile duct leading from the liver to the small intestine. Jaundice may occur, and the skin may have a greenish bronzed appearance. If the blockage can be removed either by surgery or some other means, the patient may make a satisfactory recovery. Cancer of the liver 331. Chronic passive congestion. Any condition interfering with the normal flow of blood to the heart may cause an enlargement of vessels in the liver. This is part of the serious condition known as chronic passive congestion. It is most commonly seen when the heart itself is failing. The patient suffers from shortness of breath, and his liver may be enlarged and cry tender. Fluid often gathers in the abdomen as well as in the lower extremities. The treatment is the same as for congestive heart failure, as noted on page 260. Cancer of the liver. Cancer may arise in almost any organ of the body. When it begins in the stomach or large bowel, the liver may soon be involved, mainly because the blood flows toward the liver from all the digestive organs including the pancreas and gallbladder. This is referred to as metastatic carcinoma. In other words, the cancer has come from some other part of the body. Very few cancers actually arise in the liver. Most of them come from elsewhere. Hence, the earlier the diagnosis is made, the better the patient's chance of recovery. Once the cancer has begun to grow within the liver, it spreads rapidly, eventually causing jaundice and swelling in the distant tissues. The condition resembles cirrhosis, but is more serious. There is no specific treatment generally available as yet, except good nursing care and keeping the patient as comfortable as possible. Gallbladder disease. The gallbladder is a small, pear-shaped, muscular organ closely attached to the undersurface of the liver. Its only function is to store and concentrate the bile between meals so there will be a plentiful supply when needed. Bile from the liver is a clear, golden color when formed, but after being concentrated in the gallbladder it turns a deep green. This concentrating process sometimes results in the formation of stones in the gallbladder, particularly following pregnancy in commonly overweight women. Stones may form in other parts as well as the gallbladder, but are relatively rare. 332 Liver, gallbladder, and pancreas. Many people with gallstones seem to have no problem at all, especially if there is one large stone. But when a number of smaller stones are present in the gallbladder, the patient may feel sharp, cramp-like pains all over the upper abdomen. These come on an hour or two after meals. The condition is more likely to occur at night, and may produce fever, nausea, and vomiting, as well as rapid heart and tenderness in the right upper part of the abdomen. Many patients with gallstones complain of gas and distension of the abdomen, especially after eating fried foods, fats, and green vegetables. If a stone completely blocks the common bile duct, jaundice will result and the skin will become yellow and very itchy. This is a serious condition that should be relieved at once, if at all possible. Most gallstones can be seen by X-ray when certain contrast dyes are used to outline the stones. Symptoms of severe cases of gallstone may resemble peptic ulcer, coronary artery disease, acute appendicitis, and even shingles. A correct diagnosis is therefore important, for delay could be dangerous in so serious a condition. As stated above, women are more likely to be affected, particularly during the later years. Treatment: like most other liver conditions, these patients are best treated in hospital, particularly during the acute stage. If necessary, surgery should be carried out without delay. If the patient can stand major surgery, the common bile duct should be explored and the gallbladder with its stones completely removed. Many people suffer from chronic gallbladder disease. The gallbladder fails to fill properly and will not empty in a normal manner. If the X-ray shows the presence of stones, and the patient is suffering from frequent bouts of gas and indigestion, it is best to have the offending organ removed. Cancer sometimes occurs in the gallbladder, probably due to irritation from several stones. Inasmuch as a person can live quite well without the gallbladder, it is wise to have a diseased organ removed to avoid the risk of serious complications. Pancreatitis. The pancreas, an important gland situated below the liver, produces strong digestive juices necessary for assimilation of food. Pancreatitis means inflammation of this organ. In some cases it may be rather mild, but in others it is very severe. Most pancreatitis seems. Pancreatitis and its treatment 333. To be related to some condition involving the bile ducts leading from the liver. A stone from the gallbladder may block the mouth of the pancreatic duct and cause pancreatitis. It is surprising how many patients who are troubled with pancreatitis are alcoholics. Others have suffered injuries, and still others have pancreatitis because of a peptic ulcer penetrating into the pancreas from the stomach or duodenum. In a few cases pancreatitis may follow some infectious disease, such as mumps. Patients with pancreatitis usually complain of sudden pains in the upper part of the abdomen. These may be steady and severe, or dull and cramp-like. The patient may have a fever from 100 degrees to 102 degrees, as well as tenderness in the upper abdomen, and even some jaundice if the bile ducts have been partially or completely blocked. Many of these cases come to surgery simply because the diagnosis has not been confirmed. The serum amylase test is used to differentiate this condition from other similar problems with the abdomen. Treatment will vary according to the seriousness of the condition. During the acute stage, the patient is fed intravenously. Later he may take some solid food, but only in small quantities and without any rich mixtures. He should not take alcohol in any form, for this may only aggravate the condition. Thenceforth he must live on a simple program, avoiding all stress as far